Although, as I mentioned earlier, although all of our programs and all of our NFLs provide services that meet the goals of First 5 California and First 5 Ventura County, we have a diverse set of different programs within our locations. And they do serve as a one-stop location for families who come with a variety of needs. The primary access points for services are our family resource centers. And you see here the 11 the 11 Neighborhood for Learning programs and the resource centers that serve the community within those locations. And they serve as the primary access points for services that are both NFL funded and services outside of the NFL. Some of these locations here have been established well over 20 years ago, and they are still operating. At the centers, you will find staff that is bilingual and in some cases trilingual, and you'll hear about that in just a little bit. And the staff is there and meets with the families and allows them and invites them to participate in all the different services, including some of the programs that are offered at the Family Resource Centers themselves, which we will talk about a little bit later, but they include parenting, education courses, they include health education, developmental screenings, and some of our group counseling programs. And then they are also the vehicle that we connect families to other people within the community, and we connect them and link them to the resources that are available in our community. The NFL services are coordinated and delivered in a coordinated fashion. Great strides have been taken and undertaken by each of the NFLs to create really a holistic, whole child approach to service delivery. We have to be always mindful and respectful of the diverse cultures within our community. We collaborate with a myriad of different agencies, as I said, NFL and non-NFL funded programs, to provide a host of different services to meet the individual needs of our children and families. The effectiveness of these programs and services is really demonstrated through an extensive data collection process and is evaluated by the local community and then also by statewide evaluation efforts. And programs are modified accordingly to the data that is collected. Eligibility for all of the services that we're going to highlight in just a minute are open to the children in our communities 0 to 5 and at no charge to the family. The best investments that have been identified by the Commission under each of the 3 strategies includes some of the following programs. Under high quality preschool, we have early education, early childhood education opportunities. We also have preschool scholarships, which are vouchers for some of the smaller communities that participate. And then also we expand the capacity of existing preschools and also increase the capacity of the staff that's available at the preschools. Other learning activities, we all know that too many children walk into kindergarten without any preschool experience, and we don't have enough preschool slots to go around. So we have developed other early learning activities to help close that gap. And they include programs for infants and young children, parents and infants together, prenatal and baby care classes, family literacy, kindergarten transition activities for, they're typically a 4-week introduction to kindergarten right before, in the summertime, right before a child enters kindergarten. And then we also have, and you'll probably hear about some of the programs in our Conejo Valley about the breastfeeding support and play to learn opportunities. The services that we're going to highlight in the next few slides are really encompass and will speak to one of the questions that was brought up earlier by one of the presenters of how and what happens to the referrals, or why are referrals going to the NFLs. Under services that support early learning and school readiness, we have the developmental screenings. We have public health nurses and public health educators deployed to our family centers that really help a family navigate the very complex systems and services that are available in our community. Through some of those regional contracts by First Five, we have mental health and health professionals deployed to our NFLs. We have public health nurses and educators that do perform those developmental screenings and also provide in-home support for families. We work with the Ventura County Santa Barbara Dental Foundation at many of our locations, who provides the oral examinations, screenings, fluoride treatments, and actual extractions and other cavity filling treatments. Let's see, under family support services, we have developed in our NFLs a multidisciplinary team of professionals, which includes behavioral health clinicians, public health nurses, public health educators, infant specialists that we have here, preschool teachers, family advocates, and other disciplines as our plans are developed. And this multidisciplinary team case conferences the concerns of individual children and families. We believe in the NFLs that every single family that walks in through our door, regardless of the crisis, has internal resources and internal strengths that can be tapped into to meet their personal goals. And we use a strength-based approach to match these strengths with the family's needs, with the resources in the community. And really, most importantly, to maximize the effectiveness of all of these strategies and intensive services. Oh, and one more thing that I'd like to add. I know there was a question by Dr. Deborah Thurber about why are the referrals for some of the mental health services have to flow through the NFLs, and this is the reason. The reason is that multidisciplinary team, where we have, our experience has been that families not only come in with a one concern, they come in with different concerns and all around the development of their child. And we have been able to, through this multidisciplinary team, not only be able to detect and identify a mental health concern, but also maybe a health concern, a socioeconomic concern, and as all the different needs of the family. So that is one of the primary reasons why those referrals flow through the NFLs.